Hello, I'm Dr. Jim Rudolph, geriatrician at the VA hospital in Boston.
And I'm Dr. Tia Costas, also a geriatrician at the Boston VA hospital, and both Jim and I are specialists in aging.
Tia and I spend a lot of hours in clinics like this talking to veterans about their medications, and sometimes those conversations can be really challenging.
I find it hard to determine all my patients' medications. I don't have time to do it, and when I take the time to do it, my patients often don't tell me everything they're taking.
Medication reconciliation takes time. In an ideal world, we could have patients bring in all their medications to every office visit. Or even better, we could perform frequent home visits. But we know that's not possible.
To reconcile medications accurately and efficiently, we need our patients to provide us with information about their medications at each visit.
Also, I make sure my patients realize that I appreciate how difficult it is for them to take their medications appropriately. I approach them in a non-threatening, collaborative manner, and I ask open-ended questions to obtain important information.
I agree, Jim. My patients feel more comfortable discussing their medications and any difficulties they are having if they feel I really appreciate the obstacles they face. Of course, Jim and I only see our patients in the clinic. A lot of the hurdles and confusions about medication starts at home.
When's the shuttle coming to take you to your doctor's appointment? I don't want you to miss it.
Oh, they'll be here any minute. I set that up a week ago, and they'll ring when they get here.
Okay. Just make sure that you tell the doctor you need a refill on the blue pill you're out of. And make sure you take your blood pressure pills before you leave. And how about that pain you've been having in your legs since you started that new one?
You worry too much. You know, I've made it this far. I must be doing something right after 80 years.
Okay, fine. Have it your way. Just don't forget to ask the doctor why they send you this Simvastatin.
Estradiol. Must be that new blood pressure medication the doctor gave me. Wow. Why do they make these covers so hard to come off? What tiny pills. Hello? Oh, yes. Thank you. I'll be right down. Hon, the shuttle's here. Bye.
As we have just seen, taking medications is a complex process. Acknowledging to patients that we appreciate the obstacles they face can set the stage for collaboration to create safe, individualized regimens that patients can follow. Some obstacles to medication use include vision and hearing impairment, cognitive impairment, health literacy, dexterity and strength, difficulty swallowing, complicated regimens, side effects, lack of social support, and financial issues.
While taking medicines properly is difficult, taking a medication history can also be challenging for us. In order to prescribe as safely and appropriately as possible, we need to know what medications patients are actually taking.
This is best done by patients providing us with this information, aided by a list or involving their caregivers. Open communication is essential. In order to promote effective patient-provider communication, it's critical to approach patients in a non-threatening, collaborative way. This sets the tone for ongoing teamwork with your patients. Here's an example of how the process can go wrong.
So you're taking all your medications for blood pressure, right?
Yeah, right. Blood pressure. You know what I take, Doc? I take everything that's on that computer, and there's certainly a lot of them.
How about the lisinopril I prescribed at your last visit?
Oh, yeah, I take that also.
And you're still taking the amlodipine, right?
Yeah, Doc. If it's on the list, I'm taking it.
So you're taking the metoprolol, too, and the new medicine I sent you, Simvastatin?
Yeah, my wife takes care of all of that for me. She does a wonderful job.
Wait, a minute ago you told me you took your own meds.
Oh, yeah, I do, Doc, I do. But sometimes she helps.
I need to take care of this. Okay, I'm putting in a new prescription at the pharmacy because your blood pressure is still high. You can pick it up before you go home, and also make sure you stop at the desk to book an appointment to come back and see me in 3 months. And buy a blood pressure cuff. Take your blood pressure every day and write down the readings.
Okay, Doc.
Look familiar? This is unfortunately common given busy clinics, short appointments, and long medication lists. In this case, it's difficult to tell if the patient is taking these medicines as prescribed. Maybe he's worried or ashamed to let his doctor know he's confused about his medicines or not taking his pills. Also, the patient may feel like he is being quizzed instead of having a conversation.
Two-way communication and teamwork are missing. This frustrates both the patient and the provider and compromises optimal care. A non-threatening, collaborative approach can improve the situation.
Notice that the provider was asking only yes and no questions. Patient input is essential. After all, we depend on patients to take the medications we prescribe. It's unrealistic to expect patients to recall and discuss medications by memory. A better method is to have patients make a current list of their medicines to share with providers. This way, patients become an important member of their own healthcare team. Updated medication lists can improve medication reconciliation. Let's look at a good example of a provider-patient interaction.
Mr. Carter, you sure do have a lot of medicines. How do you manage them all?
Yeah, I do have a lot. The only reason I take them all is that my wife is always on my case.
Tell me about your system for taking your blood pressure pills.
Well, I keep all my pills in a basket on the kitchen table. And blood pressure, I think I'm taking one. It starts with the letter L, 1 pill a day in the morning, just as the label says.
Okay, our computer shows that you were prescribed 3 different blood pressure medications. What other pills are you taking at home?
Oh, gee, I don't know. I can't keep them straight. My wife takes care of all those pills for me.
It's okay. We don't need to solve everything in one visit. When you go home, can you write a list of all the medicines you take and any problems that you have with any of them? And I will plan on calling you tomorrow to check in. I'd like you to bring that complete list with you to every appointment from now on, okay?
I could do that with help from my wife.
Glad to hear she's helping you with all this. Medications can really be challenging to manage. In fact, you can bring her to your next appointment if you're comfortable with that.
Oh, thank you very much.
This appointment took the same amount of time, but more information was gathered, and we get a better understanding about the patient's ability to manage his medications. This understanding helped avoid a new medication being inappropriately added. Now there is a plan in place to obtain an accurate list and involve his caregiver.
The provider asks the patient open-ended questions to elicit more information. Asking them key questions about their medication strategies makes it easier for us and safer for them.
The provider said, "Tell me about your system for taking medications." Such questions engage the patient and create dialogue.
Also remember to ask patients if there's anything else they're taking, such as over-the-counter products.
Let's look at the importance of how we ask patients about their medications and how they take them.
How are you doing on your medications?
Just fine, Doc. Only have the 2 pills. I take the blood pressure pill in the morning and my cholesterol pill at night.
Tell me about your system for taking your medications.
Well, I keep my pills in the kitchen, so when I get a glass of water in the morning or evening, I remember to take them.
Tell me about anything else you might be taking.
Those are my only meds, Doc.
Well, what medications do you use that you buy without a prescription, like from the grocery store or the pharmacy aisles?
Well, I take some pain pills for a headache, and I take a sleeping pill I got at the drugstore most nights. Sorry, I can't remember the names of those pills. Let me think. Whenever I get a cold, I take allergy medicine, and I have some cough syrup I take a few gulps of every now and again.
Are you taking any medications prescribed by a provider other than me?
Well, my orthopedic doctor gave me some strong pain pills for my sore knee a couple years ago. I still take them when it rains and my knee really begins to ache. Oh, and my eye doctor gave me some ointment a couple of weeks ago.
Are you taking any vitamins or herbal supplements?
No. Well, just a multivitamin, but I don't always take it. That's it.
How often would you say you miss your medications or make a mistake?
Not often. At most, it's once a week.
In this case, the provider asks the patient several open-ended questions to learn about how he takes his medications. However, the patient still needed some prompting and direct questioning about over-the-counter medications, vitamins, and medications from other providers. Without asking the patient these key questions, the provider would not have learned about the additional medications and adherence challenges.
Okay, let's review the steps providers used to generate medication discussions, which are based on the need to collaborate with the patient in their medication management. Think of these 3 steps as a prescription for providers. First, appreciate. Appreciate that medications are difficult to take. Consider specific obstacles patients may face and ways we can work with them to minimize these obstacles. We are dependent on the patient to take medications correctly. When reviewing medications, it's inevitable that we will hear a host of bad choices, faulty reasoning, and excuses, as well as legitimate barriers to taking medications. It's important that we let patients know that we appreciate these obstacles and want to work with them to overcome any barriers.
Second, approach. Approach patients in a way that lets them know this is a conversation, not a quiz. Tell them there are no right or wrong answers. Honest answers will lead to better care. Let patients know that managing medications is a team effort, and they are the key members of this team.
Third, ask. We need to ask open-ended questions that engage patients and create dialogue. For example, tell me about your system for managing your medicines.
Or, what medicines do you take at home?
Or, how do you take your medications on a typical day?
You may develop your own question or statement that works for you and your patient population. That's okay.
Just remember to keep it open-ended and be sure to include some direct questions about over-the-counter medications, vitamins, and medications prescribed by other providers.
These strategies can help create a framework to use when talking with patients.
The Appreciate, Approach, Ask method promotes accurate and efficient medication review. Actively engaging your patient leads to safer, patient-centered care.